Good morning, and welcome again to this second session on the history of public health for our course Introduction to Public Health. In the previous video, we reviewed some of the demographic changes occurred from the 19th century in Western Europe and during the 20th century in North America, including the sustained decrease in mortality rates and a consequent increase in life expectancy at birth and population growth. Also, we briefly discussed the difficult material and working conditions of people living in some cities in England and Sweden in the first half of the 19th century, and the main theories developed in that time that helped public health practitioners to explain the causation and distribution of disease, contagionism, miasma theory, and the gradual emergence of the germ theory. The germ theory was developed in relation to the multiple scientific advances in the fields of chemistry, clinical medicine, and especially microbiology from the second half of the 20th century in Europe. The discovery of bacteria that cause disease, such as cholera and tuberculosis, by Robert Koch, technological innovations including pasteurization and the development of vaccines by Louis Pasteur, and later the discovery of penicillin, the first produced antibiotic by Alexander Fleming in 1928, all contributed to a scientific revolution in the field of public health with profound consequences in the understanding of disease causation and distribution. If for the proponents of miasma theory, the material conditions where people live were the main causes of disease, soon after the consolidation of the germ theory, scientists now emphasized the role of biological and microbiological factors for explaining disease causation. As we also reviewed in our previous video, these changes in the understanding of health, disease, and healthcare were concurrent with a radical transformation of the patterns and distribution of disease among people living in industrial societies. Among these transformations were the decline in the burden of infectious diseases, malnourishment, and maternal and infant mortality, and the related rise in the burden of non-communicable diseases, cardiovascular disease, cancer, and mental health problems. In addition, there was growing evidence about the unequal distribution of disease among populations, which followed the pattern of class, racial, and gender inequalities, among others. Both the transformation of the patterns of health and disease at the population level and the unbalanced distribution of disease in societies exceeded the explanatory possibilities of the germ theory. In her book Epidemiology and the People's Health, published in 2011, Nancy Krieger also refers to the emergence and consolidation of eugenics as one central theoretical construction underlying the new ideas within the field of public health during the second half of the 19th century and the first decades of the 20th century. Eugenics refers to the understanding that not only germs but also genes determined people's physical capacity, behavior, intelligence, and morality, and could explain the differences in disease distribution among dissimilar human populations, providing a scientific foundation and justification for racism, which pervaded, and still does today, the European colonialist project around the world, including Nazism. In this regard, it is important to note that the first country which state-mandated sterilization for entire populations was the United States of America in 1907, even before German Nazism in 1933. From 1932 to 1972, an ethical research in the natural history of syphilis among Black American population and the unhuman experimentation in Jews, Gypsies, Communists, and people with disabilities by Nazi scientists until 1948 led to the creation of the Valmont Report and the Nuremberg Code for Research Ethics in the biomedical and public health fields.
In these shows, whites made up their faces in order to mock Afro-American slaves.
Yesterday's savages were today's brave soldiers or indigenous workers. States deployed them against those they saw as even more savage, the Germans.
During the first half of the 20th century, the developments in the field of statistics and informatics also contributed greatly to the development of epidemiology and public health in general. Scientists now had powerful informatic tools that expanded the possibilities for complex analysis of disease causation and distribution. In this sense, Robert Koch postulates about disease causation were expanded from their original basis, and the discovery of the DNA by Francis Crick, James Watson, and Rosalind Franklin opened up possibilities for research in genetics and population health. However, many epidemiologists in United States of America and England question this exclusive attention to microbes and genes and pointed out to the importance of looking also at the relationship between the host and the environment for a better understanding of disease causation and its distribution among the population. In 1974, Marc Lalonde, the Canadian Ministry of Health, proposed the concept of health field, denoting the interplay between human biology, healthcare organization, lifestyle, and environment to understand better the epidemiological transformations that we have discussed earlier. In the same line, in 1978, the Conference of Alma-Ata, organized by the World Health Organization, Pan American Health Organization, and UNICEF in what today is Kazakhstan, gathered representatives of 134 countries and international organizations in the context of the Cold War. In this international meeting, all countries agreed on the importance of strengthening primary healthcare and community participation in order to achieve, by the year 2000, health for all. This conference also emphasized the socioeconomic conditions where people lived as essential for understanding disease causation and its unequal distribution among people within the same country and between different countries. Later, in the 80s, Michael Marmot initiated and developed the theory of social determinants of health, which later would lead to the formation of the WHO Commission on Social Determinants of Health and the publication of the final report Closing the Gap in a Generation, Health Equity Through Action on the Social Determinants of Health in 2008. We will address in detail the theory of social determinants of health in the following sessions. While these theoretical developments in mainstream public health were occurring in North America and Europe, in Latin America, and in a context of neoliberal expansion under regional dictatorships, a different ideological and theoretical approach started to emerge: the Latin American collective health. Latin American collective health developed from the social medicine perspective initiated during the 19th century, a marginal approach in the understanding of health, disease, and healthcare during most of the 20th century, and also by the contribution of Latin American Marxism and critical theory. For this perspective, it was evident that disease causation and distribution were intimately linked to unequal economic and social structures that characterized capitalist societies and authoritarian governments in the region. Concerned with the gradual commodification of health services, together with education, housing, and pension systems, scholars within this position challenge the epistemological assumptions of mainstream contemporary epidemiology, such as individualism, biological reductionism, and above all, the ahistoricity of the Eurocentric and colonialist perspective in the field of public health. From the Latin American collective health, it was argued that epidemiology needed to expand its analysis to the social and cultural conditions that were immanent to disease causation and distribution, contributing to the development of the sociocultural epidemiology. You will have the opportunity to read in more detail about this perspective and its contribution for the understanding of public health challenges today in the Middle East and North African regions in one of the readings for this class. As we have seen through these two classes, the field of public health is intimately related to the epidemiological and demographic transitions of society, the political and economic conditions where people and communities live, and the technological and scientific developments occurring in our world. The history of public health needs to take into account, as we have said in the previous session, that as a scientific discipline, it is essentially a European modern invention, with all the political consequences of this statement.